Welcome back to Relocating to Mexico. No bull. Today, we're doing episode number 6. We're going to discuss healthcare here in Mexico. I have with me my partner in crime, Mexico Relocation Guide. How are you doing, Mariana?
Very well. Thank you so much for having me back.
Today, we're going to cover the topic of healthcare here in Mexico and what options people might have that are deciding to move to Mexico. This is a very hot topic. I did a couple of videos on this, and I covered private healthcare, public healthcare. I did want a follow up on Medicare, Medicaid, or not Medicaid, Medicare. But today we're going to discuss the different healthcare systems, how they differ, what your options are as far as insurance. I get a lot of questions regarding that. So we're going to just jump into it, and we're going to start with question number 1, and that I'm going to ask Mariana. She deals a lot with, in her relocation guide, she has a lot of sources for insurance if you want to get insurance in Mexico. But let's just discuss the healthcare system in general. So, what are the different types of healthcare in Mexico, and how does each one work?
Yeah, that's a great question. I think this is a very timely subject because as people start to research right their move to Mexico, it's one of the main things that I think maybe a lot of people don't really ask about, and they should. And the ones that do ask about get a lot of good and also bad information. Full disclosure, I'm not a healthcare broker. I'm not a doctor. The information that I have is given to me by the healthcare brokers that we work with, and then the doctors that I've had the honor to interview in our show. But there are basically four healthcare systems in Mexico. The most common one for most people is getting private health insurance. Uh, because you can basically go to a level of hospital that is in your budget. You have more availability to services, less waiting periods, things like that. So a lot of people usually get private health insurance. There's also INSABI, which is the free healthcare insurance for it's meant to be for impoverished people that don't have an income source where they get money taken out of their paycheck every month to be able to provide medical services. For example, like IMSS. IMSS is the Social Security healthcare system in Mexico, which you have to be an employee of either a state entity or some form of employee where Social Security benefits are taken out of your paycheck and then they're put into the IMSS hospital system. And then you have access to IMSS hospitals around Mexico. And then there's the ISTE, which are specifically for very specific employees. I'm sorry, the ISTE is for state employees. IMSS is Social Security healthcare system for basically any employee in Mexico that opts into the IMSS through employment, or their employer is covering it by taking money out of their paycheck. The ISTE is for state employees. Like, for example, if you work for Pemex, then you would normally have ISTE. It's very rare that any foreigner will get covered through the ISSTE, which is ISTE. So we don't really talk about that because it's very rare that you'll get coverage through ISTE. And then the other form of healthcare in Mexico is just paying out of pocket, which is, available basically anywhere. In Mexico, you can go to any hospital, you can go to any specialist, you can go to any pharmacy, any doctor, if you're paying out of pocket. The reason why I recommend getting private healthcare, at least even if it's for very catastrophic things, is because in Mexico, although healthcare is very inexpensive for small things, right? Like if you're going to go get x-rays, even an MRI and CAT scan, they're significantly less expensive than doing that in the United States, where that can be very expensive if you're paying out of pocket. However, if you get something very chronic that needs ongoing treatment, like cancer, or maybe you have an uncontrolled diabetes, or maybe you need a very intensive surgery with a very specialized surgeon, then those things can be very costly. And in Mexico, you normally have to pay for those, at least a portion of that upfront, which can be a lot of cash upfront. A lot of people don't have that. So anyway, so those are basically, in a nutshell, the main healthcare programs in Mexico.
And I do want to add, though, it can be costly, but I did get treated for cancer, and the price that I paid here in Mexico, we'll go into that later on in the show, but the price I paid in Mexico was a fraction of the cost that the same treatment in the United States would have cost me. And I'm going to give some examples of an MRI here versus an MRI there because I actually have personal experience with it. But you also, you bring up a good point about private healthcare here in Mexico. And also one of the things that's really great is, if you need your cholesterol medication, you just go to a doctor right next to the pharmacy and he prescribes you your cholesterol medication and it's next to nothing. So there's certain things you can pay out of pocket. And now I do realize when I do mention the figure for cancer, one thing is, yes, it was cheaper, but the second thing is when I was treated for cancer, I had U.S. insurance that reimbursed me for the whole thing. So I didn't pay that amount. So that's what that comes with a disclaimer there. And we're going to go into that option later on. But I just want to note that, when I even told some of the doctors in the U.S., some of my friends that are doctors, how much I paid for my cancer treatment, they looked at me like I must have been crazy.
Yeah.
So it is cheaper than in the United States, but you're making a good point that insurance, you still need insurance. It's not, it's a matter of maybe $25,000 versus 200.
Yeah.
So it's still a lot of money just to to stay with keep it in perspective.
Yeah,
But
you need to have some cash reserves if you're going to go insurance less, right? Like if you're going to pay out of pocket, save money every month so that you have a cash reserve in case that you need medical assistance and you need to pay some form upfront.
now let's start with the public options. The two that, like you said, Easter, the Easter has to do with government employees. Nobody that's a foreigner, unless you've worked here, actually for the government, are you going to be qualified for that insurance? So that's off the table. But you have the INSABI and
Mhm.
IMSS. Now, IMSS is a type of Social Security, and I want to go into that one first. Actually, instead of going to the free one, let's go with IMSS because one of the things that you noted was that, well, if you work for a company, you pay into this system called like Social Security. It's kind of like Medicare, I guess you might say.
Exactly.
But it's not Medicare that you only get it after a certain time. You could get it while you're an employee of the company too. Um, but I understand, and there is a way to get IMSS as a resident, even though you haven't worked or even though you haven't put into this Social Security system. So let's go into that first, because I think that's one of the things that interests a lot of expats, especially those on a budget that want to come and they're living here on Social Security. They don't necessarily have the means to buy private insurance, but they still want some type of insurance coverage. So let's
Mhm.
go into IMSS. It is true that residents can qualify for IMSS, but my question is going to be, how do you qualify for IMSS if you're not putting into this? And how does it work and how much does it cost?
It's depending on, it's on a sliding scale based on the age of the person that is applying. In order for you to qualify, you have to have basically good health, right? So I have a list here of some pre-existing conditions that would not be covered through IMSS. So like malignant tumors, anything with your cardiovascular system, pulmonary diseases, mental disorders, HIV, AIDS, kidney problems, diabetes, degenerative diseases, and then there's some other. There's like a list of pre-existing conditions through the IMSS website that basically would deny you coverage not only for those conditions, but in some cases, IMSS will not cover you at all. In order for you to qualify, you have to be a resident. Like you can't be a tourist. You have to either be a national or a resident. And you do need to present your residency card when you try to apply. The costs vary. They can start as low as 6,800 pesos a year if you're anywhere between 0 to 19 years of age. And then let's just say roughly, let's say you're 60 years old. The cost would be 15,300 pesos, which is about 750 US dollars a year. If you were 70, then it goes up to 15,900 pesos a year, which is roughly $800 a year. And then if you're over 80 or 80 and above, then it's 16,450 pesos a year, which is again roughly like $850 a year.
Now, my understanding is that when you talk about, cardio conditions or heart conditions, we're not talking about I've had a heart attack. Well, that would probably disqualify you,
Yeah, that would probably disqualify
period.
you.
But things as simple as, I'm on metformin for prediabetes, or I'm on a high blood pressure medication, or I'm on a cholesterol medication, that can actually disqualify you for IMSS. So these pre-existing conditions we're talking about, and I think that what we need to understand, there's a difference in the United States. After Obamacare, they said basically they can't disqualify you for pre-existing conditions. But what we know in the United States as pre-existing conditions is like, oh, I had cancer, or I had a heart attack, major pre-existing conditions. When we talk pre-existing conditions here in Mexico, it can be as simple as taking high blood pressure medication. And
Yeah.
that's what they can define as a pre-existing condition. And we're even going to go into that with private healthcare insurance. That can be, they take your blood and you have high cholesterol. They can consider that a pre-existing condition. So that's something very important to note that I noticed when trying to navigate around. Now, my next question with IMSS system, there are some limitations to it. And can you actually go into those limitations? Because it's a little bit different. Medicare, and I try to compare this to Medicare or something similar because it's through the Social Security system. And on Medicare, you can kind of go to any doctor that accepts Medicare. But in Mexico, it's different. And can you kind of explain how it's different, how the IMSS system works that's different than the normal system? You just can't go to the doctor of your choice.
Yeah, so basically, IMSS, just so everybody is clear on it, is a tax-funded healthcare system in Mexico, right? So basically, the people that earn a living and have taxes that are paid through the Social Security system. So even if you have, for example, let's say household work that is working full time, you're supposed to register them, right, with the Social Security system in Mexico, and therefore they get benefits like IMSS. Um, some things to know about IMSS, you're assigned a local clinic, right? So you basically can't choose whatever facility you want to choose. If you lived in Mexico City, it might be the facility that is closest to your alcaldía, which is like basically your county, because Mexico City has several alcaldías inside of Mexico City. That's a huge city, so that's a kind of a like a weird one, right? Whereas like if you were in Cholula in Puebla, then maybe, there's only probably one IMSS. I'm not really sure, but there's probably only one, and you would get assigned to that facility. Some other notable things about IMSS and limitations are not all medications are always available. If you're hospitalized at the IMSS, a friend or family member must be with you at all times overnight. So basically, they must stay with you. You can't be left alone because they have to help you go to the bathroom, get you water, things like that. Maybe change your sheets, different things like that. That there's not enough nurses to go around for everyone, right? There are no private rooms, so you would normally share a room with up to 5 other people. You must bring your own toiletries like toilet paper, soap, uh, towels, etc. Right? So it's very basic, and that's why it's so affordable. I mean, it's very, very affordable. Usually, there are no English speaking doctors. It just depends, right, on which clinic you're going to. The doctors at IMSS, by the way, are great. They are normal doctors that have done extensive training. They are well trained, well qualified. Usually, a lot of them even have private practices, and then they do what's called like a uh, kind of like a service, right? A social
Mhm.
service to the IMSS. So they are normal doctors. Just because it's a very basic healthcare system
And
doesn't mean.
some of them very well renowned surgeons and that do the
Yeah,
actual operations and everything else. Um,
exactly. Yeah,
very
so
well
don't
known in their
overthink.
field. Yes. And the other
Yeah.
thing about another thing, real quick, before we continue about medication, um, you made a good point because my father-in-law gets his diabetes medication there and everything else. And sometimes they go to the IMSS office. See, you don't get your medication to a pharmacy. It's not like in the United
Mhm.
States where you present your Medicare card or Medicaid card and then you get your medication filled or your prescription filled. No, you go to the actual clinic and you say, I'm here for my monthly medications. And if they have it in stock, they have it in stock. But if they don't, you're out of luck. So that's one of
Yeah.
the things about medications. Um, let's go ahead and continue here because I know there's some more limitations as far as surgeries and stuff like that.
Yeah, there's some waiting periods. So usually the best way to look at it is when you register for IMSS. Um, you usually don't get the full benefits of IMSS until after 3 years. So for example, uh, there are and waiting periods means like you cannot go to IMSS for these things until this amount of time has happened. So basically, they're trying to avoid, right, people coming in with something that they might have already had, and they're just trying to get IMSS to cover it. For example, 6 months are for breast lumps. So if you feel a breast lump, if you're doing a check while you're showering or whatever, and you feel something, you can't go get like basically a mammogram at IMSS for free until after 6 months. If you're having a kid, then it's 10 months. And that makes sense, right? Because usually it takes 9 months for full term pregnancies. Other things like gynecological conditions are 1 year, um, sinus and nose surgery, 1 year, varicose, varicose surgery, 1 year, hemorrhoid and rectal surgeries, usually 1 year. Your tonsils, 1 year. Hernia surgeries, 1 year. Disc herniation, 1 year. 2 years are orthopedic surgery, so like knees, hips, things like that. And usually, another limitation is that the larger the city, the better the IMSS hospital will probably be equipped with equipment and specialists and things like that. Whereas smaller towns usually will have a limitation of specialists and equipment, etc.
And sometimes for your surgeries, you have like you were saying, a waiting period. It's like a tiered system. The first year you get so many benefits. The second year you get so many benefits. It raises your benefits raised, and then the third year, and then so there's that waiting period, and then there's the other waiting period for an actual like they diagnosed me with a bad knee. There may be a waiting period before I actually get operated on. You can't just
Exactly.
on. That's one of the differences between private healthcare and public healthcare here.
Yeah, there are
Um,
usually very long lines at IMSS hospitals because you have to consider that this is uh, what a lot of people have, right? The Mexico, the major part of Mexico probably has either IMSS or they don't have insurance. So a lot of people have private health insurance, but the ones that can't afford it, right, either have IMSS or they don't have insurance at all. So the people that do have IMSS, well, there's only so much staff, and there's not an IMSS hospital in every corner. You can't go to just any hospital. So there's usually very long waiting times and long lines. For example, my grandfather, 3 years ago, he's he was 80 years old at the time. He fell, he broke his hip, he shattered his hip, and he had a lot of damage right in the hip area. he was basically waiting for a surgeon for 2.5 weeks at the hospital. He was medicated, so he was comfortable. He wasn't in
Mhm.
any pain, but he was waiting for about 2.5 weeks for an actual surgeon to be able to operate on him on
Wow.
something that in a private hospital, you could be seen the very next day. So just some things to consider for people.
And this brings me to the next type of insurance, which we call INSABI, which is like really basic. It's free,
Yeah.
but there's like a lot of restrictions to this. Can you go now? First of all, my first question is, can a resident qualify for INSABI? And the second question is, how exactly does it work, and what are the limitations of INSABI versus basically IMSS? Because it's still the public healthcare system, but it's a one step lower because it's the free healthcare system, truly
Yeah,
free healthcare system.
truly free. So I have some notes here because I want to give you guys as much factual information as possible. So INSABI is this is basically covered by the government, right? It's subsidized by the government. It's free to enroll. Yes, residents can apply for it as well as nationals who don't have a regular job. Let's say you're a house cleaner that doesn't get full time work, or maybe your boss hasn't enrolled you into the social security system in Mexico, so you don't have IMSS. Well, then you could get INSABI. Or there are a lot of indigenous people in Mexico that live off the land, and the government has subsidized, some farmland for them, and they don't have a regular job, so they have INSABI. So INSABI was made by the current president, AMLO, Andres Manuel Lopez Obrador, in 2020 to help, right, impoverished communities have access to free healthcare. There used to be a program before, which was Seguro Popular, but it was kind of always managed by each individual county and city. And so he's trying to like basically make a centralized free healthcare system. Um, but it is very basic, very, very, very basic. And in some cities like Guadalajara, Mexico City, Monterrey, you probably have, again, access to better healthcare or better facilities because they are bigger cities. They have more income from the city, right? All those things matter. Whereas if you're going to a very small town, like somewhere in the middle of nowhere in Puebla, well, then you're obviously going to have a much more limited clinic. There is no cost to enroll in INSABI, but I will say this just with some heart behind it, that it is meant to be for the very impoverished people. So keeping that in mind, if you're coming to live in Mexico and if you don't have the funds to apply for private healthcare insurance, and you don't have the funds to apply for IMSS, I would really think twice before applying for INSABI, because you may be taking healthcare from somebody in the area, right, that is a local Mexican who really, really can't afford it, where you might be able to put some money aside
And
for your
one
medical.
one thing that I'm going to note about that, and especially you bring up a great point because it is for the impoverished people and that type of thing. And one of the things that people need to understand, I just discussed IMSS about not having medications available sometimes when you go. Um, you know, I personally know people that are on Insabi that are impoverished and everything else. And one of the things that when we talk to them, uh, we ask them, oh, I took my daughter to the clinic today because she got bitten by, actually, we had to pay for the, not that we had to, but, my daughter got bit by a dog and we went to the Insabi and they didn't even have alcohol in the clinic. This is in San Miguel.
Yeah,
And we were like, no, you need to get the rabies shot. I don't care. We're taking you to a private doctor. We're going to get your daughter taken care of. So not only is this for impoverished people, but it's very limited on what they have, the supplies they have. And so you bring up a good point, is what little that they do have, you may be taking away from someone that really, really, really needs it.
exactly.
And the other thing to note about Insabi is that one of the things that I've also noticed about Insabi is that if you do in fact get an operation, first of all, you have to go to a certain hospital designated by Insabi. For example, in San Miguel, you actually have to maybe travel to Mexico City. You can't just get it done in the hospital in San Miguel. And then not only do you get it done in Mexico City, but they may say 60% of the cost, you have to pay for it.
Right.
So it's not like IMSS where you kind of get everything covered if it gets approved. Um, if there's any major medical, as a matter of fact, in my neighborhood, there was a worker that when they were building a house fell from the top of the house,
Oh,
and he needed some major surgery. He was in really bad condition, and I know that all the workers in the area, and we even had to donate money so he could get his brain operation or his brain operated on, because there was going to be a cost to it, even regardless of the fact that he was on public health insurance. And unfortunately, the architect didn't have him on Social Security, which is not legal. He got in trouble later
I'm sure.
on. But this is the situation that worker was in. So it's very important to note that it's one thing to say that Mexico has free healthcare, but then you have to realize what free healthcare means here in Mexico. It's very
Absolutely.
different.
Yeah, if you're coming from Canada, you might think it's like, oh, at the level of Canadian free healthcare. It's not. Another thing is not everything is covered. So very much like IMSS, doesn't cover all conditions. For example, cancer, heart attacks, again, cardiovascular, failure, diabetes, hepatitis, major surgery, sometimes not covered, and long-term treatments are usually not fully covered. INSABI does have a list of conditions that they will not cover, um, but it's also based on every single person's individual needs because they take it on a per case
Basis.
scenario.
Hmm. And this brings us to probably the best type of healthcare in Mexico. And this is one that, I'm going to kind of discuss my story, but let's first, before I discuss my story of my experience with the private healthcare system, let's first go into the caveats of the private healthcare system, insurance, for example, because it doesn't work like it does in the United States
Right.
or in Canada or in other parts of the world. So you have this private healthcare system that's totally different than the public healthcare system. One of the things that I noticed in the United States is, we go to the same doctor, whether we're on the private or the public. How even Medicaid patients go to the same doctor. Here in Mexico, it's a little bit different. You go to a different doctor, um, and usually these doctors they're private doctors. You pay them, and if you have insurance, that type of thing. Can you just go into this? This comes to my first question on private healthcare. Can you actually describe the private healthcare system and how it actually works?
Yeah.
Basically, your options. The first option is pay out of pocket for everything you do. Uh,
Hmm.
the second option is medical insurance. I would think, and if you can go in a little bit into how it works and how private medical insurance works, because there's some limitations to that also.
Right. So for some medical companies, not all, it depends on which medical company you're going with, but let's just go based on the common Mexican health insurance companies, right? The ones that are based in Mexico that service usual Mexican nationals. Usually the way it works is you have different coverage amounts per condition. So if you broke, let's say, your femur, right? Like if you damaged your femur or some part of your leg, then you would get coverage for that part. So it's different than, like, for example, in the United States where you have a coverage for the full family or for the full person of a certain amount, a deductible, right? Or not a deductible, but a coverage like total amount. Then in Mexico, it's fully different. You actually have a coverage amount, right? A total amount that the insurance company will cover per condition. So it's say that you have a heart attack, right? If you meet that coverage full in this amount, or if you meet that max amount, and then later on you break a finger, that's a fully, completely different diagnosis. You do normally pay one premium. It is usually paid per year, whereas, in the United States, we're used to paying monthly, but in Mexico, usually you're paying per year. It's totally based on the level of hospitals that you're going to go to, your current health condition, your age, and some other factors like maybe where you live, things like that. Like different cities have different prices. Normally, there are a variety of brokers, right? And a broker basically has access to several different insurance companies, and they can give you different quotes for different insurance companies. So they are basically like your one-stop shop for you to get different prices from different insurance companies. And your broker is really your point of contact, the person that you would talk to if you needed to file a claim, if you needed to get approval for a certain surgery or a certain type of procedure. They are really truly like your point of contact. So that's why it's really important to find a broker that you really trust, that you really feel like they know what they're talking about, and they're really good at explaining things to you, because
And
not all brokers are created equal.
you have a list of these brokers in your guide.
We
Am I
do,
correct?
yeah, we have a
Vetted
list.
brokers. I need to stress vetted
Yeah,
brokers, people that you've actually interviewed based on their reputation and everything else.
and
So,
I have actually talked to their customers, and their customers are happy with the way that they've worked, or maybe have had claims with them and things like that. That they're very reliable.
and one of the things that there's these deductibles because they can work with you. I have a Mexican insurance excuse me, I have an insurance policy, and they work with you on these deductibles. The higher the deductible, the less the premium.
Exactly.
Also, as you get older in age, the premium increases. Also, after a certain age, you can apply. You can, if you already have it, you can keep it, but after a certain age, you can apply. And I know that there's different ages because what I was told by my insurance company, and I think you had an insurance company that would let you go a little bit higher in age, but my insurance company, I think, said they cut you off at 62. You can't apply brand new. But I think you said that you had an insurance agent that was able to do it a little older. I think
70.
up to 70, yes. And but it
For a
all
new
depends on,
customer. So it's important to note that it's for new customers. So if
yes.
you have insurance and you're 69 and you're going to turn 70 next year, they're not going to cancel you. You get
No,
grandfathered in.
no, no. This is for news customers. Exactly.
Right.
It's not, that's what I was referring to a little earlier, that if you already have the insurance, you keep it until after. Uh, but that's one thing. And these deductibles, when they say 50,000 pesos for one condition. So for example, let's say I get a heart attack and I'm just using 50,000 pesos off the top of my
Mhm,
head.
mhm.
That means out of pocket, I have to pay that 50,000 pesos and the rest of it is covered. And then I have a maximum of 3 million, 5 million, 10 million pesos that I can use for this heart attack. But what happens is every subsequent, like, for example, I have to go to, I don't know, rehabilitation treatment.
Sure.
I might get another heart attack again, and I might need another surgery. Once I met that 50,000 pesos, everything's covered up until that ceiling. Now, let's say tomorrow I paid my 50,000 pesos. I had a heart attack and I fell down the stairs and broke my arm. Uh, not very, I'm just using hypotheticals here,
Yeah,
but I broke
sure.
my arm. And then all of a sudden now, but my arm, I broke it because 50,000 pesos, trust me, just to set a cast you're not going to meet your deductible. But I broke my arm and I'm going to need, because my shoulder got thrown out and it's major surgery, then that's going to be another 50,000 pesos for that deductible for that condition. And then everything that happens to your arm afterwards or related to that shoulder or arm, then it's covered. You don't pay. So that's something that's very important to note, that when you say per condition, everything is per condition. Like you have a maximum amount per condition, and then you have a maximum amount for um,
Of a deductible.
the
Yeah.
deductible. Yes. And
Right.
it's per condition. Everything's per condition. Now, this comes to my next question. Do the insurance company, private insurance companies, and we actually discussed this a little earlier with with Obamacare, where they said you can't disqualify, because at one time in the U.S. they were disqualifying people for pre-existing conditions. If you have a pre-existing condition with private insurance, will they cover you?
It depends on the insurance company. So sometimes, yes, they will cover you for everything, but that pre-existing condition, depending obviously on the pre-existing condition. If you have, for example, cancer, probably not. If you get cancer once you've already been insured, then yes, you'll continue getting coverage, right? But if you are coming in with a pre-existing history of having had cancer and maybe you're fully free of it and you're clean and you're healthy, you're still too high risk for that company to insure you because it could be a possibility of it coming up again. You have to consider insurance companies are businesses, right? They're in the business of not paying claims. But that's something like that, right? Something big. Usually like cardiovascular things, it won't cover you. Like you mentioned, if you're taking certain medications, they won't cover then cardiovascular health if you're like on blood thinners or things like that. If
And,
you have,
and one of the things that I'll note, they'll have you take an actual physical exam. You have to go in, you have to draw your blood. Some of them, they just want your blood work. For example, my insurance policy just wanted my blood work. Others will actually make you go to a doctor
yeah,
and get a full physical.
right. Not all of them do. Some
Mhm.
insurance companies, basically have waiting periods, right? If they, in lieu of you getting a physical exam before they approve you or don't approve you, then there are waiting periods. Like you normally have to wait a year or 6 months, maybe even 2 years, depending on the insurance company. So there's ways, right, for them to just make sure that they've got you covered and they've got themselves covered.
Yeah, and I think on ours, my wife, on her policy, there was a waiting period that if you get any female issues, you have to wait 2 years, I think it was. And on my policy, because I got my cancer treated previous to getting the policy, I'm not covered for cancer. Uh, so that's an example of how you're not covered for certain things. Now, the other thing, you know, I don't want to go into this because premiums can vary from anywhere from $300 a month to $1,000 a month,
A lot.
depending on lots of money. But one thing that I will note, I think that I just want to take away from this is that um, compared to what you might be paying for private insurance in the United States, it's a fraction of the cost. Now, at the same time, if you're coming on Social Security and you only have a limited budget, it may not be an option for you because you're looking at least $300 to $500 a month. And like you said, it's usually paid annually or biannually or quarterly. So you might have to come up with, if you're looking at $300 a month, quarterly is going to be a good amount of money. So, um, and I do think my insurance does let you do it monthly, but most of them don't. Um, and the,
They may just charge you more. Like they
and
may just charge you slightly more to make monthly payments as opposed to.
Exactly. And the other thing that I'll note about my insurance is it's actually New York Life. So the major insurance companies, a lot of them are international, New York Life, Aetna, some of the big companies. They're not just, some company that's only well, there are some that only operate in Mexico, but some of these are international, well-known. Like I said, mine's through New York Life. So they're very good insurances. Um,
Yeah. I
and
have a few like a few examples of premiums that I got
mhm.
sent from um one of the brokers that we recommend. If you want me to share any of that, I can share it with you and you can put it on the description if you want so people
Yeah, if you
can
can
read
do
it.
that, just send
Yeah,
me
I can share this
just
with
an
you.
example of premiums, and then I'll put in the description of the video. Don't, like I said, don't take it to. I mean, don't take these to heart. There's a lot of variables in this, and like I said, even for example, they're not going to cover cancer. They may not charge you as much, or if you have like five pre-existing conditions, and they're not going to cover you on that. It might be less. The higher the deductible, the less it is. The older you are, the more it is. And
The
then after,
year of hospital.
Yeah, and then even the hospital, because see, I have a plan. For example, you can get a plan where, for example, I'm Seguros Monterrey. You can get a plan where only you can use it in Monterrey, and that's
Right.
cheaper. And then they have a regional plan that, in the north of Mexico, you can go to any place in the north of Mexico. I have the highest plan where I can go anywhere because I actually live in San Miguel. Well, I'm back and forth from San Miguel,
Sure.
Monterrey,
Yeah.
all over. So it's a matter of customizing what exactly you need. So the price could vary, especially when you start say, hey, I'm only going to be living in Puebla and I'm only needed in Puebla and I only want to be covered in the hospital in Puebla, then it's going to definitely be a lot cheaper than being covered nationwide. But you also got to remember, if you leave Puebla and go on vacation to Cancun, you're not going to be covered. So
Exactly.
those are the things that you need to look into. And I guess, and then the other thing is also that I've also noticed is that when you say conditions, for example, but I have a different, I have Mexican insurance, but I also have U.S. insurance, which I'm going to explain my personal situation. But like, for example, I go to a cardiologist. That stuff is normally covered in Mexican insurance, but I have a 50,000 peso deductible. So technically I go to the doctor, it's $40 or $50 or $60.
Yeah.
Actually, my copay is $30. So literally if I go and I submit it, all the paperwork, of course, some people may
It
want
took
to
you
submit for the
forever to meet that
$10.
deductible.
Yeah, it'll take you forever to meet that deductible. So just keep in mind too that a lot of things you'll just pay out of pocket. But if you pay out of pocket, like I said, I just finished seeing a specialist, an endocrinologist, for example, and my actual fee or his actual thing was $60. My copay is $30, and I'm going to get $30 back. And it's even to the point where, do I want to fill out all the paperwork to get $30 back? So
Yeah.
there's a lot of services, even with a specialist, if you go to a specialist or an endocrinologist in the United States and you say, I want to pay out of pocket, you're looking at a couple of $100 for a visit versus $80 for a visit. So
Hmm.
private healthcare is something that's definitely an option, but there are the limitations there. Now, this brings me to the most commonly asked question that I get. Can I use my Medicare in Mexico?
Um, kind of. So yes, but it has to be a life-threatening emergency. And by life-threatening, and it also depends on the Medicare. So not Medicare A or B, but it needs to be it needs to be an Advantage plan. So your Medicare A and B can only be used in the United States, right? A is for like regular medical stuff, and then B is for medications, I believe, right?
Mm-hmm.
So that has to be used in the United States. You have to add a Medicare Advantage plan to your Medicare Part A and B in order for it to cover you in Mexico. And then whoever manages your Medicare Advantage plan has different rules. So they might have limitations. They might have certain residency requirements. Residency not meaning like permanent or temporary residency in the United States, meaning like you are in the United States for a certain amount of time and haven't left the United States for a certain amount of time. They might also have limitations like you can only get covered for up to $50,000 or something like that. And it has to be life-threatening emergency. So like if you, let's say, had a really bad case of a stomach bug and you had, uncontrollable diarrhea, uncontrollable, something that could really mean that your life is in danger, then, and by the way, you have to pay for it up front at a Mexican hospital. You have to pay for those services up front and then get reimbursed by Medicare Advantage. So it's
And then
not like
some,
Medicare Advantage pays for it for you.
and then sometimes they require you to, for example, let's say, like you said, the stomach bug, all they cover is getting you stabilized till they can get you to the United States. It,
Exactly.
not necessarily like let's say you need an operation that can
Mhm.
wait or that they can stabilize you, then they stabilize you and then you're responsible for getting yourself to the United States. Now, I do know that a lot of people do stay on Medicare, and what they do is once a year they travel to the United States, go see their doctors. If they need an operation, they stay there with family, they get their operation and they come back. But you also got to consider that it is an inconvenience.
Yeah.
Another thing, I'm not too well versed in Medicare because I'm not of that age yet. But one of the things that you can do if you live outside the United States, once you turn 65, I think you have to opt into Medicare and pay those Medicare premiums with your Social Security. If you're on if you're drawing Social Security, if I'm not mistaken. But there is a way to opt out of Medicare premiums if you live in Mexico. You tell the Social Security Administration, "Hey, I don't live here. I don't need Medicare. I can't use it." But there's an important thing. This is one of the things that everybody even has asked me: should I opt out? Here's the important thing to note, especially if you're not sure if you're going to stay in Mexico for the rest of your life. Because if you opt out of Medicare, what happens is those premiums that you opt out of and that you're not paying right now, let's say at 65, I say, I don't need Medicare. I don't want Medicare. I live in Mexico. And then let's say at 80 years old, you move back to the United States. From 65 to 80 years old, you're 15 years later. You move back to the United States and say, oh, shoot, I need Medicare because I can't afford, I don't have any private insurance. You actually have to back pay the 15 years of Medicare premiums that you weren't paying. So one of the most important things to remember is if you opt out of Medicare, either you're going to opt out of Medicare because you're never going to use it, even if you move back to the United States,
Right.
or you're going to live in Mexico the rest of your life. You know that for a fact. That's one of the things that's very important because I've seen some people
And you
get
don't
hit.
care about getting, life-threatening emergencies covered because you've got those covered.
Or you got them covered under a different thing in Mexico or type thing. And my particular situation, I'm in a different situation too, where I might not need it at 65. I have to wait till I'm 65 and hopefully it doesn't come up on me too quickly. But so that brings me to the next question, because there's another type of insurance that veterans have that's through the VA. I think it's TRICARE. And then, of course, if you're in the United States through the VA hospitals. Another question I get a lot is, can you use your VA benefits coming to Mexico?
So I'm actually not the TRICARE expert, right? Because we have very few, I feel like I have very few veteran customers that have asked this question. And there's a lot of very confusing information about whether TRICARE will cover you if you're living overseas. TRICARE on their website says basically, yes, we cover veterans anywhere in the world. Now, I don't know what the limitations are based on how long you have to be in the United States or how long can you be outside of the United States for them to truly cover you for any reason whatsoever. And again, it's the same thing. You would basically pay out of pocket and then submit a claim with TRICARE. The only thing that I know for sure that veterans can use in Mexico is a company called mediciamerica.com. And it's a guy that started this company out of Mexico City. He will basically make your Medicare medications claims for you, get you your medication, and then ship it to you to Mexico. So you can sign up with him. He has a membership. It's mediciamerica.com. But that's the only true service that I know of in Mexico where veterans can take advantage of this and get their medications to themselves in Mexico.
And I'm going to mention one, they call themselves Lakeside Medical Group. They do also claim that they can file Medicare claims. I have no earthly idea how they do it because by law, you have to file them in the United States. I mean, you can't file them in Mexico. It's kind of an HMO program where you have to go to their doctors. And then supposedly use your Medicare and your treatment is free, like if you were insured. And they have certain hospitals you have to go to. So I've heard varying stories about this. Um, I'm not trying to say don't use them because I don't know how legitimate or illegitimate they are. I will tell you from a law enforcement perspective that, there are a lot of schemes in Medicare and Medicaid. Now, this Lakeside Medical Group will also file your claims if you have private insurance also. It's not just
Yeah, they
Medicare and
work with
Medicaid.
like
Uh,
150 different
yeah, they also
insurance.
work with, now with private insurance, I see how they could probably do it because private insurance, some of them will cover you overseas and all of that stuff. How they do it with Medicare or Medicaid, I don't know. But like I said, there's a lot of scams that go on with Medicare and Medicaid. I'm very familiar with them because I worked down in South Texas. We did a lot of work with HHS, and there's doctors that file claims on things they didn't do. Um,
Mm.
those types of things. So you need to be very careful. Also, I have had one or two people in my group that have said stay away from them because he had a problem in Guadalajara. Basically, he ended up being left out in the cold, um,
Mm.
probably because it wasn't one of the hospitals that Lakeside covered. So, and then I also, I'm under the understanding it's hard to get in. They have like a waiting list. They don't.
They have a very long waiting list. Yeah.
It's a
They take
period of
a wait
time to get
time.
in. So that is an option, but like I said, I just caution you in before you decide to go with that option. I'm not saying don't use it because, if it works, it works, but
Yeah.
I have no idea how it works. And maybe if you do look into that option and you talk to the people at Lakeside, they'll probably be able to better explain how it works. And there may be some limitations to it,
Yeah.
actual limitations to what they can claim on Medicare or can't. Uh,
I think that's the key to any of these things. Like, this is your healthcare, this is your medical, right? So take matters into your own hands and make sure you understand what is being covered, what isn't. Like, really take some time to think of the questions that you would be asking, whether you're going with Lakeside Medical Group or whether you're going with, a healthcare broker, or whether you're getting Medicare Advantage or what have you, right? Like, make sure you understand what is going to happen in your specific situation if you need medical assistance.
yeah, and I think this goes back to what we've been preaching is doing your research. Research everything. And the biggest problem, and I've gone into this, is you go into a Facebook group and one guy will tell you, I use Lakeside Medical Group and I'm fine. And then you can go and you can look on another group and someone say it was a disaster story. So what you have to do is, even if you see all of these things on Facebook and everything else, and like I always tell people, the most consistent answer is usually the one, because you'll get a consistent answer like, no, 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 it doesn't work. No, it doesn't work. Then you get one person say, no, it does.
Yeah.
The consistent answer is going to be the one that's going to be more than likely the right answer. And maybe this person, it did work for them, but you got to remember that everybody on Facebook, as much as they're trying to help or not help, everybody has a different experience, different situation, a different, just because it worked for me doesn't mean it's going to work for you. I'm going to give you my situation. And I can tell you probably about 80% expats don't have my situation. So I can't give you advice and say, oh, do this, do that, do this because it works for me. Well, yeah, it works for me because I'm in a particular situation compared to what you may be in. So, it's great to get this information off of Facebook and everything else. And I always say, go to as much Facebook groups as you can and everything else. But at the same time, verify it. Go to the different
Yeah.
sources. Just like we just said with Lakeside Medical Group, I said, call them up, ask them exactly how do you do this? How do you get Medicare? You're not supposed to be able to file a claim. How do you do it? Tell me, even if it's under the table, how do you do it? That
Yeah.
way,
Make sure
even if they tell you it's under the table, hey, at least you know what you're getting into. Because if Lakeside Medical Groups gets in trouble and gets indicted in the United States because they're filing fraudulent Medicaid claims, you don't want to. And I always say this: don't get caught with your pants down. Know what you're getting into. And that's what I used to say this in the immigration world. when a lot of these immigration changes were coming about. Just know what you're getting into. Um,
Absolutely.
and that way you know the consequences of what you're getting into and you're not surprised. Um, like,
Right. We do
you
the
know,
same thing in the online guide, by the way. Like, I don't just go based off of people's experience on Facebook groups. Like, I go based on what is written on the government websites, what the actual facilitators that we work with are telling me specifically for certain cities, right? So it's very transparent. So if it's not in the online guide, if a specific thing that you've overheard or heard through the grapevine is not in the online guide, it's because I haven't verified it. So it's not because, I don't want to put it in there. I'm probably aware of it, but it's just not verified. So I do the same thing as you, Ernie. And I preach the same thing. Like, really do
I,
your research.
you know what, and it really gets me because and I hate to, like I said, beat a dead horse like I always do, but and actually it's in your industry because you offer, in a sense, expat services. A little bit different than, you don't offer the services afterwards. You offer the services in helping people move. But this market has grown so much that it's become very cutthroat. And a lot of these expat services are fighting for this legitimacy. I'm a subject matter expert. I know this because I've been living here. I know this because I've done 50 million processes. I know this because my website's #1 in Mexico, or I have 150,000 people in my group. And a lot of people, and actually one of the things that I remember, I was doing a video, and someone says, well, what makes you the expert to be doing this video on the subject? And my whole, when I responded, I put out my whole resume of everything I've ever done in my life with Mexico and everything else. And I have family here. And at the very end, you know what my words were? I'm not an expert. Even after I
Yeah.
put on my resume, I'm not an expert. Um, and I'm not a subject matter expert on Mexico. I'm just here to say what I've heard, not what I've heard, but what I've experienced myself. Working with people like you, Mexico Relocation Guide, where you see this firsthand. I've texted you several times to say, is this really happening? I have several contacts, not just you, that I contact, uh, that are everything from in the journalistic community to the government, that I can ask, is this really happening or is this not really happening? And I don't only take that person's word for it. I collaborate it with other people. What are you seeing in this place, or what are you seeing in that place? And sometimes what I'm discovering is, like, for example, what's happening in Guanajuato is not happening in Monterrey. So,
Absolutely.
so when people are saying, one of the biggest things that went crazy was this FMM thing. And, you know, when it came down to it, it's only 4 airports that aren't, now it's 5
Yeah.
actually.
Yeah.
No, it's now Mexico City got added to it. So,
Mhm.
one thing we need to understand is that, you know, verify, do your research. And that's one of the things that you pointed out right now about the Mexico Relocation Guide, is that she does verify her information. The contacts inside are vetted, interviewed, well known in their field for what they do. And that's half the battle.
Yeah,
Now,
and this isn't going to be the end all be all, right? Like, some people are going to use your channel, they're going to look at the online guide, they're going to look at another resource. Like, it's a big decision to move to Mexico. So, and some people, just pack up their bags and they come and and it works out.
like I
Um,
did.
yeah,
Actually,
it
it's funny
works
because
out.
that's what I did. But it's what I did. But
Back then, things were different.
that advice, I don't give it.
Yeah, and things are changing, right? And so you want to make sure that, one, you're not going to get in trouble. That two, you have peace of mind that if you're traveling from one city to the other, you have all your paperwork in order and you're not going to get, hassled by a immigration officer or a random checkpoint or a cop. All those things. in your
And
rental contract, that you're writing down the right rental terms and the right rental agreement, or that you understand your rental agreement and all those things.
exactly. Now, what I'm going to go ahead and do to wrap this up, I'm going to just give everybody my personal situation, which
Hmm.
not everybody's fortunate enough to be in, but this is what I do. And um, the reason why I bring up my personal situation is because I did get cancer. I have been treated by cancer. I did use the private healthcare system. I was treated by two world-class doctors, world renowned in their field. First of them, first doctor was a head, ear, nose, and throat specialist, and the second doctor was an oncologist that's very well known throughout Europe and Mexico. So I got top notch. I probably better care than I would have gotten in the United States. Actually, the reason why I came to Mexico is because the United States was actually failing me. Um, so I can speak for private healthcare that it is the best that I've ever experienced in my life. I would probably, and I say this, and I'm no knock on the United States, but it's better than anything that I've ever experienced in the United States. The doctors here actually explain to you your condition. They actually explain to you how your body works, why you are feeling a certain way. Whereas in the United States, the doctor just gives you a pill and says to take it and don't ask him any questions. And there's a reason for that. A lot of times it's because of I have a lot of friends that are doctors. A lot of reasons it's liability reasons. It's not because the doctor's being arrogant or it's not because the doctor's being mean. A lot of times for example, in the United States, one of my friends was telling me, if I tell you not a big deal, I don't think it's anything serious, and then he goes and does tests, and then it is something serious, um, and then all of a sudden the person's suing me because I told him it wasn't serious, and now it's serious. In Mexico, private doctors have certain protections, and that's one of the things that they can be more candid with you, more open with you. Um, Also in the United States, for example, if you have when you're in the hospital, you have your cardiologist, and then you have your, I don't know, your regular doctor inside the hospital, and one doesn't want to make an order without the other one, and then it's all about liability in the United States. And here, the doctors talk to each other. As a matter of fact, I even have my doctor's WhatsApp. I'll give the endocrinologist. I went to the endocrinologist and he says, okay, well, the day before yesterday, it wasn't yesterday. I went to the endocrinologist the day before yesterday. He says, you know what? I need for you to do these blood tests. I went straight to the hospital with he gave me the list of the blood tests. I did the blood test and he says, oh, and the hospital had him ready by about noontime. And he says, just send me a WhatsApp and with your blood test,
Wonderful.
and then I'll
Yeah.
tell you what to do. And you don't have to come back. You don't have to come back for me to read it. And we were talking about some medications, if I could get on them or not. And I just sent him my blood test, and he says you're good to go with the medications. I didn't have to go for a follow-up appointment. I didn't have to go to to see my blood test. I saw my blood test at noon the same day yesterday. I took my blood at 8 in the morning, and by noontime, I logged onto the portal and I had my blood test results. So
Yeah.
that's what's very different about, especially with private healthcare here. My particular situation is I got cancer, and um, I'm actually pensioned from the United States government, and I kept my healthcare insurance. It's through Aetna, and it just so happens that Aetna will cover me overseas, but I have to pay up front.
Hmm.
Um, I was having some issues in the United States, so I came here to see a head, ear, nose, and throat specialist. Um, I had a lump in my throat, which turned out to be that didn't turn out to be cancer, but that's what discovered my cancer. And the specialist said, "We need to get you in right away for an MRI." And this is an MRI that I was waiting in the United States. It had already been a month and a half just to get pre-approval. The MRI usually runs three to four, $5,000 in the United States. It ran me $270. This is an MRI with contrast. And at this point, I was willing to pay out of pocket. I didn't even care if I had to pay $5,000 because I needed to figure out what it was. And I was very, as a matter of fact, I even tell my story that the lady, when she said that'll be so many pesos, I don't remember how much, $270 was, but I did the math in my head and I'm like, are you crazy? Are you sure it's not dollars? And she's looking at me like, no, it's pesos. And I'm like, okay. And she's looking at me kind of weird, like, is there something wrong?
Yeah.
And I even say this to this day, when I walked out of that place, I don't know if that lady thought I was crazy or what, because I just pulled out my credit card and I said, oh, okay.
You're like,
And I was
oh.
I was in sticker shock. I was in sticker shock that that an MRI that I had been waiting a month and a half to get a pre-approval only cost me $270. So what I did was I called my insurance company because I was going to need an operation. This operation to remove the lump, which was a cyst, ran about $7,000 or $8,000. And this is hospital stay, whole 9 yards. And this was in one of the finest hospitals in Monterrey. This is in the hospital in San Pedro. San Pedro is considered the Beverly Hills of Mexico, basically, if you think about it.
Yes.
So I was literally in the rich part of town in Monterrey where I got treated, the best, most expensive hospital. And this surgery turned out to be about $7,000 or $8,000. And I contacted my insurance company and they said, not a problem. Pay up front and we'll reimburse you at 90%. So I got reimbursed at 90%. And then, of course, unfortunately, found out I had cancer through some lymph nodes that they found inside when they were inside me. And my cancer treatment was very expensive. It was about $30,000. That is a lot of money. But compared to the United States, you're talking about close to $500,000.
Yeah, if you didn't have insurance in the United States, that would easily bankrupt you.
And here's the thing. I actually played around with going to MD Anderson because they're the best cancer center. And my oncologist kind of laughed and says, you know what, we've got the same or better equipment than MD Anderson has. And actually, he even pointed out that they have a radiation machine in one of the hospitals here, that there's only seven of them in the world. And MD Anderson is in one of the places that has them.
Wow.
And
Yeah.
the only reason why I didn't get treated with that newest one, the brand new VESA machine, is because that one's more for pinpoint accuracy, like where they have to really kill a tumor, pinpoint. It's the most accurate radiation machine in the world to date. And one of the hospitals here in Monterrey is only one of 7 locations in the world that has it. My particular radiation treatment had to be more like everything. So that machine wouldn't have helped. But I would have had to pay out of pocket at 90%. If I would have paid out of pocket, probably $9,000 to $10,000 in the United States. Oh, actually, I have a $12,000 out of pocket on my insurance, so I probably wouldn't have reached the 12,000, but I would have been close to 8 or 9, and I paid maybe 2,000 or 3,000 or 4,000 out of pocket after I was reimbursed, of course. Now I have the luxury, of being able to put it on the credit card and wait a couple of weeks to get a check, but that is an option if you have it. One of the reasons I bring this option up is because I didn't even know that my insurance company would cover me. I just called them just for the heck of it to see. And not all insurance companies will cover you overseas, but mine does. And my insurance companies knows well and aware that I live in Mexico. It's not because I live in the United States. Now, when they send me the check, they have to send it to a United States address. And either I have to have a family member deposit the large checks, or I can do it on the mobile deposit. Now, what we did do is we got private insurance also, because it is affordable for us on my pension. It is a fraction of what it cost in the United States. It's probably about what I pay in my premium for my U.S. insurance, because I still do have to pay a percentage. But you got to remember, on my pension insurance or my U.S. government insurance, I'm paying a percentage and the government's paying the rest. So even though I may pay $300 a month to the U.S. government, or get $300 a month taken out of my check, the actual premium is like more like $1,200 or $1,300 a month that's actually being paid to the insurance company. So yes, out of pocket, I pay $300 a month to keep my insurance, but I pay around the same amount for a Mexican insurance policy. But the reason why I have it is, let's say I'm in a car accident, and I'm incapacitated, and I say, take me to the private hospital. I have this insurance, blah, blah, blah.
Okay.
I'm not worried because here's the thing: when you go to a private hospital, okay, you go into the emergency room, someone's got to give the cash up front or the credit card, or you don't get treated. It's not like the United States where we'll cheat you and we'll figure it out later. No, they'll actually hold you in the emergency room and say, where's your insurance? Where's your,
Sure.
yeah. Now, don't get me wrong. If you have insurance, your insurance will get with the hospital right away and you'll get it done. So, it's not what you think, like, oh, I'm going to be sitting in an emergency room with a heart attack and I'm waiting for my insurance to approve me. No,
Right.
the insurances are co-located. Actually, all the insurances are co-located in the hospital. So when you show up, whatever they need to do, all they do is they verify you have the insurance and then they figure it out later, but they verify. So we have a policy which is still affordable to us, which I pay around the same amount of money. But like I said, that's $600 out of my pension that I can afford, but maybe some other people can't.
Right.
So that's what
And
I
some
do.
people may not have a pension or be, in
Exactly.
a position where,
Or an insurance policy that covers them through their pension, like I do.
yeah. Yeah.
Um,
I mean, there's a lot of like people in their 40s, 50s, even early 60s that don't qualify yet for things like Medicare. Right. And those people are the true ones that are like, well, what do I do? Well, for you, yeah, definitely get private health insurance in Mexico that may be a high premium, right? But a very a very high premium and maybe lower deductible. Wait, I'm saying that wrong. So maybe high, like low premium or high premium, depending on what you want.
mhm.
And then the coverage amount will change based on that.
So
So
what I
it's like a
do
catastrophic insurance.
exactly, and then the other thing is that my Mexican insurance won't cover me on any cancer treatment, so I have to do PET scans every 6 months. I think I'm going to be doing the last 6 month PET scan now, and pretty soon, and then I'm going to have to do it every year. So what do? I pretty much do most of my medical through reimbursement with my U.S. insurance because it's a lot easier, and I have to meet a deductible of, I think it's $350 and then $700 for the family. So, I meet it pretty quickly, and then everything gets covered at 90% and I get reimbursed. And then I have a Mexican insurance policy for anything, or if I have a heart attack tomorrow and I need it to go into the hospital, you know, I go into the hospital and I'm not worried about filling out the claim forms. Now, the one thing that I do have to say that if you do have American insurance that covers you, like I do, one of the catches is you have to get, for example, sometimes I've had to get notes from the doctor of what exactly they did. They want detail of usually the hospitals here are pretty good about giving you a detail of everything that they did. Sometimes you have to be calling back and forth. You have to fill out a claim form. So if you're incapacitated, it's not as easy. And that's why I have Mexican insurance. But that's my personal situation. And because a lot of people are confused when I say my U.S. insurance picked up my cancer, but then I'm saying I have Mexican insurance, but that's why I have it. So, those are the options in insurance. I'm also going to bring someone on. I'm going to have another person on another subsequent one of my expat interview series that's going to discuss. There's other options. There's international insurance, travel insurance, which they call international travel insurance, that I believe, where you pay a premium and wherever you're at in the world, they cover you. And I'm going to have that person on to talk about that. And then there's also what a lot of people have invested in, for example, even people in Medicare, is what they call emergency evacuation insurance. So like, let's say you get in a car accident and they actually can evacuate you on a helicopter or an airplane back to the United States to get a whatever care. And the actual insurance policy will pick up the cost of the emergency evacuation from Mexico back to the United States or whatever country. Actually, several countries offer this,
Your home
uh,
country.
your home country, so that you can get medical care. And that may be an option for some countries that have free medical care, where you just, you know what, if I get in a car accident, they stabilize me. And actually, that includes getting you stabilized to be able to travel. And they will cover whatever the hospital stay is to get you stabilized and then get you on a plane, a medical flight to get back to your home country. So that's another option. I don't know anybody in that realm, but I know that it's offered. A lot of people talk about having an emergency evacuation policy.
Yeah, there's companies like SkyMed and
Mhm.
MedBack. Mhm.
And then when I was serving as a diplomat, I used to have that through the State Department. You know, they would any kind of major medical condition, they would do emergency medical evacuation, and they would cover the whole thing. So that's another option. So
Yeah, the biggest thing for anybody looking into medical evacuation is actually understanding when they will and when they will not fly you back. Because it's not entirely like, you can just say like fly me back. There has to be certain conditions.
exactly. And like we say, it goes back to researching, knowing what you're getting into. Um, so to wrap this up, I'd like to thank you, Mariana, as always. Um, we're already on episode number 6 of the show, and I think it's been a great success. And I think we're covering topics that are important to everybody. I like
Very
to,
important.
and I'd like to thank Mexico Relocation Guide for doing this show with me. And I can't say enough about Mexico Relocation Guide, like I always do. Uh, they have a guide. If I have a coupon code for 10% off, and I really suggest that you think very seriously of the doing the Mexico Relocation Guide. I even had my last live stream. I had someone ask a question. I'm kind of on the fence about moving to Mexico. What would you advise? And one of my advices was, well, you know what, go visit Mexico. And then I even brought up the fact that, there's certain people that do relocation tours, like you do these relocation tours where they take you to different places, but these tours are geared towards, basically what's the neighborhoods like in this area? What's the cost of living? What's the,
Yeah.
I brought that up. I brought the guide up, also
With no
because
agenda to sell you anything, which is important because I mean, a realtor could do the
exactly.
same thing, and you might get pushed into buying something or renting one specific place versus another.
And one of the things is you also have a private Facebook group where you give advice. You also write articles that you email out to your relocation guide members. Um, Everything from, actually, I even saw your last one on how to use WhatsApp, because WhatsApp is very big here.
Yeah.
So, she thinks of everything almost. As a matter of fact, I probably don't know a thing that she hasn't thought of, because every time she comes up with something, I'm surprised, because I'm like, wow, that is important here in Mexico, and I never thought about it. So, I would say that, it's well worth the investment, and even just the contacts alone. Uh, it's growing. The contacts are growing um, on a daily basis, or monthly or weekly basis. It's great to have you here and be able to give some great information about Mexico, and we'll continue to do so. And hopefully, and one of the things that I did mention in my last podcast is we may I'm not my last live stream is that I may make this into a podcast,
Mhm.
but we'll have to see what happens.
They'll have to stay tuned for the update on that.
Yeah, we'll have to stay tuned to see if I actually. It is quite a task, so we'll see if I'm gonna be able to do it. But thank you for being on the show, for letting me have you on the show, and we'll see you soon. And stay tuned for the next episode.
Thank you guys so much for watching. Thank you so much for having me.